Greetings, President Gary Huang, President-elect Ravindran, Chair of Rotary Foundation Trustees, John Kenny, members of the Board of Directors, and the members of the Board of Trustees, past and present. Thank you. It's a real honor for me to be here today. And what an incredible collection of leadership from all over the world in this room today. I know only Rotary can organize and bring together in one room such tremendous leadership. So thank you for doing that. We need this in the polio eradication program. So on behalf of the 350,000 children that were getting paralyzed every year when we started, and on behalf of the more than 10 million children that have been protected from paralysis since we started, and for all the future generations to come, on their behalf, I welcome the new district governors-elect to this assembly. You are the key leaders who we count on to taking us forward in the global polio eradication program in this coming year. Now, I would like to start by asking you to please close your eyes and imagine someone that has really inspired you by doing something that has affected millions of lives or has done something that has been very, very meaningful to you personally. Now open your eyes, and when I do mine, I find that I am uniquely lucky because I am looking at a large collection of leaders, the Rotarians, who have inspired me throughout my career in polio eradication. Now, today, I want to share with you that what Rotarians mean to the global polio eradication program, to me, and to the parents around the world. You are, in fact, the first group of people that I'm speaking to in my new role as the head of the Global Polio Eradication Initiative, the new leader in the new arrangement of this global partnership. And I am truly honored and proud of this privilege. Now, many of you, like me, have worked with and admired Dr. Bruce Aylward, the Assistant Director General of WHO. And as you just heard from President Ravindran, Bruce has been assigned full-time to work on this terrible Ebola outbreak. However, I am honored now to be taking the new role of the head of the GPEI in working with the Rotary leadership. It's a real honor. Now, my relationship with Rotary, which spans over my 20-year career of polio eradication, is very, very dear to me. I have worked with Rotarians out in the trenches, real tough places, and I've also worked with them in high offices in other parts of the world, at the other end of the spectrum, if you will. Rotarians have often brought to me the light at the end of the tunnel in my darkest times and hours when we were really stuck in a bad situation in a program. Bill Sargent, in my early career, allowed me to host the first partners meeting at WHO and showed me the power of Rotary and the power of the International Polio Plus Committee and the Rotary Foundation. I have gone and monitored vaccination campaigns and NIDs in the deserts of Egypt with Bob and Ann Scott. I have also gone on the Capitol Hill in Washington, D.C., when I was director of the Global Immunization Division at the US Centers for Disease Control, and admire the amazing advocacy of Jim Lacey and his team to ensure funding by the US government. I have gone with Rotarians to meet with heads of states or to engage the European commissioners in the European Parliament. So this journey has been long and varied and very, very fruitful. But my most treasured experience has been working with the Rotarians, with the Rotary leaders in India. Eradicating polio in India was a tremendous and very difficult challenge. There were days, there were times when we felt we had come at the end of the road, like this picture depicts. Repeatedly, Rotarians came to our rescue. They motivated us, they cleared the pathway, they opened the doors for us to go and vaccinate children in some of the most difficult corners, difficult areas of the world in India. They engaged the leadership effectively and pulled off miracles. This is a photo during an outbreak in Bihar, a state of India, when there were no other options for us to ship vaccine in an emergency. Within an afternoon, Rotarians met with the Minister of Railways, and we had a special train being loaded for vaccine to be shipped immediately to Patna, Bihar. That is how they brought the light at the end of the tunnel repeatedly in the program in India and elsewhere. Now, gathered in this room today is the leadership that has the power to sway the balance of the eradication program in our favor. What you will do when you take up your positions in July is going to make a huge difference. And this pretty girl is watching you through those lovely eyes in that mask. And she's expecting your leadership to bring us closer to the goal of polio eradication. Now, I have also come here today to ask you a question, which I will do towards the end. But before I do that, I also want to share with you our amazing achievements together, where Rotary and the rest of us, particularly with the support of Rotary, have made great progress in last year. 50%. When we began 2014, 50% of the world was living in areas that were certified to be free of polio. And those areas had used the same vaccine, same political will, same financing that is needed in the rest of the 50%. What was holding the rest of the population, a large part, was India. It was in early 2014 that 3 years passed, and at that time, 80% of the world was living in areas that certified as polio-free. That is the Southeast Asia region. And India now has become a beacon of light for countries that are still challenged by and struggling with polio eradication. Many people thought that it was biologically impossible to eradicate polio in India, but the hard work of Rotarians, their leadership, the commitment of the government was essential in ensuring success in India. Now, when Rotary started us on the path to eradication in 1985, the Polio Plus journey, we were still dealing with 3 types of wild polio viruses: type 1, type 2, and type 3. I'm happy to report that type 2 virus has not been seen anywhere. The type 2 wild polio virus has not been seen anywhere since 1999. Last year, we also celebrated an important landmark. It's been 2 years since the type 3 polio virus has been seen anywhere in the world. So we are now quietly getting confidence that this third type 3 virus has also been eradicated. We are now left with type 1 polio virus, and that also in very few places around the world. So this is what the world map looked like in 2013. And I wanted to bring your attention to Nigeria, which had about 53 cases of polio reported, type 1 polio reported from Nigeria last year. And it also exported the virus to the Horn of Africa, specifically in Somalia, which led to an explosive outbreak in the Horn of Africa that spread to Ethiopia and surrounding and adjoining Kenya. The progress in Nigeria in 2014 has been truly remarkable. With 53 cases in 2013, Nigeria has reported only 6 cases in 2014. With the last case reported in July, so we are coming up to a 6-month mark with no case of wild polio virus reported in Nigeria. This is truly unprecedented. However, we need to consolidate this progress. We need to maintain and accelerate momentum. The worst thing we can do is to become complacent at this time in Nigeria. Nigeria is heading for elections. It's very important that we close our ranks and maintain the momentum towards success. Now, the world of polio plus now is very different than it was even 12 months ago. You might recall, I talked about the outbreak in the Horn of Africa, but we also had outbreaks in the Middle East, importation of virus from Pakistan into Syria, and further spread, and also outbreak in Central Africa. I'm also very pleased to report that those outbreaks are now under control, and in the last case we have seen in these outbreaks was in Somalia in August of 2014. So we are making very strong progress against these outbreaks. I want to really acknowledge the immediate support Rotary provided to enable the program respond to these outbreaks. And it wasn't only the immediate response. Rotarians themselves dug in and did, as they usually do, to do whatever it takes to stop polio anywhere. Your grassroots mobilization is what makes Rotary such a compelling and incredible organization, and it has helped us overcome these outbreaks in all the theaters where these outbreaks happened. Thank you, Rotary. Rotarians not only inspire and compel others to work, they really get their own hands in and get into the action and start vaccinating where it is needed most. Rotary has been really, really inspiring in their support to areas that are most challenged by polio. Now, we are also facing some of the toughest challenges the program has ever faced, and unique challenges, particularly in Pakistan. But we are also learning very important lessons with these challenges. We are learning how to vaccinate in some of the most insecure and high-threat areas of the world. Again, Rotarians are right there with us, helping us to learn from these challenges and overcome these challenges. It is really going to be up to you, especially the district governors-elect, to motivate, guide, and provide leadership to the Rotarians all around the world as we come up to these challenges. It is only appropriate for me to talk about challenges when all the best leadership in the world is in one room, because it takes leadership to solve challenges and overcome obstacles. So, Pakistan has seen a resurgence of polio, the largest number of cases reported even within Pakistan in the last 15 years. 85% of the world's cases in 2014 occurred in Pakistan. In fact, Pakistan and Afghanistan both reported more cases in 2014 than they had done in the previous year. But we have now also entered the low season for polio virus transmission, which means now is the opportunity to catch up with this virus and bring it under control. A lot of work and a lot of energy has been spent in Pakistan now to prepare a very strong low season intense vaccination program. vaccination of children who are on the move, particularly the internally displaced families because of the conflict in the north. Those children are getting vaccinated. Vaccination is resuming in areas where it was suspended in previous years. And thanks to the work of Rotary, the political leadership is getting aligned. Aziz Memon is here. He has been instrumental in getting the political commitment going in Pakistan. We know from Nigeria, we know from Egypt, we know from India that how important it is, the essential role of political leadership in a country to support the program. Here you see the Prime Minister chairing the National Task Force meeting of polio, and then you also see Rotarians working with the daughter of Benazir Bhutto, whose political party controls the essential province of Sindh that is home to the city of Karachi, which is an endemic reservoir of polio right now. So again, thank you, Aziz. Thanks, Rotarians in Pakistan, for their tremendous ongoing effort, and they need to be further accelerated. So in the coming months, we will join hands, we'll consolidate our efforts, we'll close our ranks to further gain momentum in Pakistan against polio virus, the last reservoir of polio virus in the world. Now, more than 4 months have elapsed since we have detected a case of wild polio virus on the entire African continent. This is unprecedented. But we need to build our surveillance further so that we get greater confidence in this progress. We cannot afford surprises at this stage in the program. We need to build immunity of children across Africa. Here is a mobilization you see in Cameroon in this photograph. Our worst enemy right now would be a false sense of security that the job is done in Africa. The progress is great. We have to keep moving in that direction. I wanted to talk about, because I know the discussion in the Rotary leadership has started about the legacy of Rotary in polio eradication. And the contributions of Rotary have been strong, essential, and very, very effective. But there is one particular aspect of the role of Rotary in the global program that I want you to think about, which is the role of leadership that Rotary plays. We as technocrats, as scientists and technicians, focus on the virus. Rotarians give the program the human face. They worry about the child, the family whose life is destroyed by this terrible virus. You have brought humanity on top of our science in this program. So that's one. But second is your leadership that is so essential to the work of Rotary. We often make the mistake, we other partners make the mistake of trying to apply or trying to solve managerial problems through technical solutions, and they don't work very well. What Rotary has taught us is to apply leadership solutions to management problems, because they then have a lasting impact and a lasting effect. So as you think about the legacy of Rotary, you bring this unique leadership, your ability to mobilize at the grassroots, your ability to mobilize political leadership, the social change. That's the best you can offer to other health and development programs. Thank you for what you've done for polio in this regard. So each of you, I know, does remarkable things every day. And I know that if every Rotarian engages in polio eradication like never before, there is no question in my mind that we will succeed and succeed soon. What I need from you is to engage and motivate your political leaders, like we see what is happening here in Canada. The Canadian Prime Minister, Harper, has committed funding to the polio eradication program, and you see the Rotary leadership flanking him in this photograph. I need the district governors to motivate and engage their districts for fundraising for the program. It's very important that local clubs are engaged, particularly clubs that are in the highest risk areas of the world. This is a bicycle from the Rotary Club of Lahore, which is in Pakistan. It's very important, the local mobilization, the local club engagement, and your efforts to continue to engage, motivate, and inform the communities in these high-risk areas. Now, I mentioned earlier that I was going to ask you a question. I'm going to be flying this afternoon to Nigeria to participate in the expert review committee that is meeting on the 21st and 22nd of January. I'm flying out this evening, and I want to go with immense certainty and confidence that the entire Rotary world is behind the program. And so I want to ask you, can I rely on your support and engagement? The district governors-elect in particular, are you willing to travel with me, with all of us, till the end of this journey of polio eradication? Thank you. Thank you. And this is the overwhelming response I was expecting, and I am truly overwhelmed. Thank you for that. So, as I leave you here today with the certainty of your support and the certainty of our success, I want to remind you that there were times when we felt that the challenges in Egypt were insurmountable. We could not overcome the amazing obstacles in India. But now, those challenges are behind us, and with your support, we overcame them. I am now looking forward to the future very soon, when we will together reflect and said, did we really think that those challenges in Pakistan and Afghanistan were so difficult that we could not overcome them? I am confident that together, and with your support in particular, we will overcome them. This is the Rotary engine of progress, and our progress has continued over the years because of this engine. This is also the Rotary engine that is going to bring us home to a polio-free world. Thank you very much.